Hodgkin lymphoma in children is a type of cancer that affects a lymphatic system, which is a critical component of the immune system. It is less common in children than in adults but is still a significant health concern. The approach to diagnosis, treatment, and follow-up care for children with Hodgkin lymphoma may differ slightly from that for adults due to the unique needs of pediatric patients. Types: Classical Hodgkin lymphoma. Nodular sclerosis, the most common subtype in children, characterized by the presence of large, thickened lymph nodes. Mixed cellularity, the subtype with a mix of different types of immune cells and Reed-Sternberg cells. Lymphocyte-rich, features a higher number of normal lymphocytes with fewer Reed-Sternberg cells. Lymphocyte-depleted, the rare and more aggressive subtype. Nodular lymphocyte-predominant Hodgkin lymphoma, less common in children but can occur, characterized by different cell types and often the better prognosis. Symptoms of Hodgkin lymphoma in children may include swollen lymph nodes, painless swelling in the neck, underarm, or groin areas, fever, persistent or recurrent fever without a clear cause, night sweats, heavy sweating during the night, weight loss, unexplained weight loss, fatigue, extreme tiredness that doesn't improve with rest, itchy skin, general itching, though this is less common in children, pain, sometimes pain in the lymph nodes after consuming alcohol, although this symptom is less common in children. Diagnosis: physical examination, checking for swollen lymph nodes and other physical signs. Imaging tests: chest X-ray, to look for enlarged lymph nodes or tumors in the chest. CT scan, provides detailed images to assess the extent of the disease. PET scan, helps evaluate the activity of a lymphoma and its spread. Biopsy, excisional biopsy, removal of an entire lymph node or part of it to check for cancerous cells. Core needle biopsy, removal of a small sample of tissue from a lymph node. Bone marrow biopsy, to determine if a lymphoma has spread to the bone marrow. Laboratory tests, blood tests, to evaluate overall health and check for anemia or other abnormalities. Staging: Hodgkin lymphoma in children is staged to determine the extent of the disease. Stage I, involvement of a single lymph node region or a single extra lymphatic site. Stage II, involvement of two or more lymph node regions on the same side of the diaphragm or localized involvement of an extra lymphatic site. Stage II, involvement of lymph nodes on both sides of the diaphragm, possibly including the spleen. Stage IV, widespread involvement of one or more extra lymphatic organs, e.g., liver, bone marrow. Treatment for Hodgkin lymphoma in children typically involves a combination of therapies. Chemotherapy, often the primary treatment, using a combination of drugs to kill cancer cells. Common regimens include adriamycin, bleomycin, vinblastine, dacarbazine. Radiation therapy, used to target specific areas, particularly for early-stage disease or residual disease after chemotherapy. The use of radiation is carefully managed to minimize long-term effects on growing children. Stem cell transplant. Autologous stem cell transplant involves harvesting the child's own stem cells before high-dose chemotherapy and then reinfusing them. Allogeneic stem cell transplant uses stem cells from a donor, considered for relapse or resistant cases. Targeted therapy, medications that target specific molecules involved in the growth of cancer cells. Examples include brentuximab vedotin. Immunotherapy uses the body's immune system to fight cancer, with newer treatments and clinical trials exploring this approach. Follow-up care: regular monitoring, routine check UPS and imaging to monitor for recurrence or long-term effects of treatment. Managing side effects, addressing any side effects from treatment, such as growth delays, fertility issues, or secondary health concerns. Long-term surveillance, ongoing monitoring for late effects of treatment, such as cardiovascular problems or secondary cancers, psychosocial support, providing emotional and psychological support to the child and their family throughout treatment and recovery. Prognosis: early-stage Hodgkin lymphoma generally has a high cure rate with appropriate treatment. Advanced stage Hodgkin lymphoma, the prognosis is still favorable with modern treatments, though outcomes can vary based on individual factors. Conclusion: Hodgkin lymphoma in children is a serious condition but often has a good prognosis with appropriate treatment. Early diagnosis and comprehensive treatment plan tailored to the child's specific needs are crucial for achieving the best outcomes. Ongoing follow-up care and support are essential for managing the long-term effects of treatment and ensuring a good quality of life. If you have concerns about Hodgkin lymphoma, consult with a healthcare provider specializing in pediatric oncology for detailed guidance and support.